The following step-by-step instructions describe how to repair small tears in the skin of the Zoe Gynecologic Simulator. These tears most often occur at the bottom of the model, the portion near the legs and perineum. They usually occur while removing and replacing the skin foam assembly. Tears should be repaired as soon as possible after they develop. Using a model with torn skin will make the tear bigger, and bigger tears are more difficult, even impossible, to repair. The following materials are needed to make repairs: replacement skin, which is included with the model; glue, also included with the model; sandpaper to roughen the skin surface; alcohol or spirits for cleaning the skin; and scissors to cut the skin patch to size. The glue provided in the repair kit bonds almost immediately with a very strong bond. Be careful not to get any on your fingers or any other surface. It is also an eye irritant. Use in a well-ventilated area and wear eye protection if available. Be sure to read the instructions on the package before use. Step-by-step instructions. Prepare a work area in a well-ventilated space and cover it with newspaper. Remove the skin and foam assembly from the model. This makes it easier to bring the edges of the tear together and to apply the patch securely. Do not separate the skin and foam. Measure the tear. With ordinary scissors, cut a patch of skin that will cover the tear and extend an additional 2 to 3 centimeters around the sides and top of the tear. Do not cut the patch too small. With sandpaper, roughen an area around the tear that is the same size as the patch. Also, roughen the side of the patch that will be in contact with the model. Clean the surfaces with spirits. Apply a thin layer of glue to the patch. Be sure the glue extends out to the edges of the patch. Once the glue is applied, handle the patch only by the edges. Be very careful not to get glue on your skin or in your eyes. Bring the edges of the tear together and carefully apply the patch. The bottom edge of the patch should be even with the edge of the skin where the tear started. Apply pressure to the patch until set, usually about 10 seconds. Wait at least 1 hour before putting the skin and foam assembly back on Zoe. For instructions on other types of repairs, please read the instruction booklet that accompanies this video. For instrument placement of an IUD within the first 48 hours postpartum, a special kit is available. This kit can be used with any Zoe model purchased since January 1997, when the simulator was adapted for this purpose. The adapted Zoe comes with a standard introitus in place. With this introitus, you can conduct any of the procedures that were performed with the previous Zoe model. Changing the uteri and cervices is performed in exactly the same way as with the previous model. The postpartum IUD insertion kit consists of 1 special introitus with vagina and rectum, 1 duckbill cervix with patent os, 1 gray locking ring, 1 48-hour postpartum uterus with a dilated patent cervical os that allows passage of an ovum or placental forceps. To use this kit, first remove the standard introitus. With the skin and foam off the model, pull straight outward on each of the 4 white locking pins visible on the introitus. Be careful. Pulling on the introitus with too much force can tear it. The special introitus comes with the duckbill cervix and locking ring already in the vagina. Be sure the locking ring is screwed on tightly to hold the cervix in the vagina. Before installing the introitus, attach the uterus to the cervix. To install the postpartum assembly, gently fold the introitus in half. Insert the folded introitus and attach uterus from the back of the model. Once through, unfold the introitus and align the locking pins with the matching holes and snap them in place. Replace the skin and foam assembly on the model as described earlier and adjust the skin tube lining the vagina around the duckbill cervix.